Live?
Yeah, you're live.
Good afternoon, everyone, and welcome to our second PHS Virtual Club, which is part of a series of webinars that will be hosted by PHS for the purposes of professional growth and development. All these webinars have been accredited. A mighty thank you to our employer for that. And one CPD point will be accredited to those that attend. My name is Veronique Jordan, and I will be the moderator for this session. Ms. Nuzazi Maeni will be our presenter for this session, and she will be unpacking the topic Vicarious Resilience. The COVID-19 pandemic brought on unexpected psychosocial challenges that many have had to adjust to. From these experiences, our mental health was challenged. This journal article expresses the significance of vicarious resilience amongst health professionals. Furthermore, it expresses the positive impact and professional growth health professionals would gain from witnessing their clients' resilience. Ms. Maeni is a registered counselor and one of the EAP team managers at PHS. She has extensive experiences in employee health and wellness. And Ms. Maeni, we look forward to hearing from you. Before we jump into the session, I would like to go through the house rules. Please note, in order to qualify for the CPD accreditation or point, you would need to stay logged in for at least 90%, around about an hour of the session. But don't just log in, focus and listen to the session so that you can fully benefit from the time spent with us. To ensure that you do get your point from the session, please leave your details, which includes your full name and surname and your registration number in the Q&A section of Zoom. Lastly, I would like to ask that we keep the questions till the end. Please feel free to leave your questions in the Q&A section, or at the end, raise your hand and then we'll be able to attend to your question. Once again, welcome everyone to our virtual journal club, and thank you for joining us. Now, without further ado, I present to all of you, Nuzazi.
Thank you so much, Veronique. Welcome everybody to the, as Veronique had introduced you, to the virtual journal club. The presentation this afternoon will be on vicarious resilience. So whether you are going into work or working from home, the COVID-19 pandemic has probably changed the way you work. As health professionals, how you cope with these emotions and stress can affect your well-being, the well-being of the people you care about, your workplace, and your community. As the COVID-19 pandemic challenged and changed our mental health, it is critical that we're able to identify our mental and emotional downfalls, and more importantly, be able to build the capacity to overcome. So what is resilience? The slide that I'm sharing with you displays different definitions of resilience from different theorists and scholars that have studied resilience and surrounding concepts around it. So as you can see, Ledesma reiterated that it is the ability to bounce back from adversity, frustration, and misfortune. Another theorist indicated that it's a developable capacity to rebound or bounce back from adversity, conflict, and failure, or even positive events. Another one indicates that it is a stable trajectory of healthy functioning after a highly adverse event. And another one was the capacity of a dynamic system to adapt successfully. So as you can see, they all pretty much run into the same road to indicate that it is it's the ability to bounce back from anything traumatic or any difficult experiences that you have encountered. A comprehensive definition of resilience is a process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family or relationship problems, serious health problems, or workplace and financial stresses. As much as resilience involves bouncing back from these difficult experiences, it can also involve profound personal growth. Health professionals who work with survivors of severe trauma typically hear stories and horrible traumas and observe the resulting associated pain and other distress. Yet their work does not need to focus only on horrors and suffering. Trauma practitioners also frequently have the opportunity to bear witness to the enormous resilience possessed by many survivors. Although not all health professionals draw this out of their clients or focus on the positive. In addition to being affected by their clients' trauma stories, health professionals can be affected by and learn something from their clients' stories and examples of resilience as well in a positive way. If health professionals working with trauma survivors inevitably become burnt out, develop compassion fatigue, and experience vicarious trauma to the extent that it will be debilitating, experiencing no positive effects, then certainly their overall well-being will be negatively compromised. Clinicians working with these survivors can be positively affected by witnessing how the survivors cope effectively and overcome significant trauma to lead healthy and meaningful lives. Just to go back into time, I would like to perhaps maybe bring forward or discuss the background and see where vicarious resilience comes from. Vicarious resilience is a relatively new concept developed by Hernandez, Gangsai, and Ekstrom, based on their research with psychotherapy professionals who treated victims of political violence and their family members. It involved the process of these health professionals learning about overcoming adversity from the trauma survivors they work with and the resulting positive transformation and empowerment in those health professionals through their empathy for and interaction with clients. Just as vicarious trauma involves the transformation of the therapist through the empathic engagement with clients' trauma stories, so too does the process of vicarious resilience, but in a different and more positive and healing direction. Both processes are seen as natural and normal in the context of trauma work and can occur simultaneously in any given trauma therapist. Although through their study, the researchers noticed that amongst the health professionals working with trauma survivors, some made specific reference to inspiration and strength they drew from working with clients whom they sometimes described as heroes. The researchers developed an interest in integrating vicarious learning and resilience into their theory and practice by proposing then the concept of vicarious resilience. This led them to speculate that working with trauma survivors had the potential to affect and transform health professionals in a unique and positive manner. Now we're going to look at the factors that empower and promote well-being. To put the slide into perspective, whilst Hernandez, Gangsai, and Ekstrom were studying and developing the concept of vicarious resilience, they found that vicarious resilience in psychotherapy professionals working with trauma survivors was a factor that helped to empower them as well as sustain them in their work and promote their personal and professional growth. Some of the most frequent themes mentioned by the health professionals in their study was that the power of witnessing and reflecting on survivors' enormous capacity to heal from serious trauma. That's the first one. The second theme that popped up was becoming transformed and taking control over areas of their lives that were within their control. Another theme that emerged from the study was that the health professionals were led through their work with survivors to reassess the dimensions of their own problems. For example, seeing their own problems as less serious than before, or altering their definitions of their problems, or even seeing the opportunities available in the situation and recognizing that their problems can be overcome. Another theme was deepened understanding of the role of religion and spirituality in healing from the trauma. Another one was becoming better able to tolerate frustration and developing hope and commitment to the work. Experiencing their clients as models and important sources of information for the therapist's own learning about coping with trauma and hardships was another theme that emerged from the study. We're going to now look at the common causes of vicarious or secondary trauma stress in health and health professionals who work with trauma clients. The first concept is the concept of trauma. So working with trauma survivors as a health professional is very challenging and frequently places the professional at risk for difficult counter-transference reactions, vicarious trauma, and symptoms of burnout. So these are overlapping work impact concepts, and we are going to explore these more to better understand where vicarious resilience emerged from. The first point we have there is trauma. Traumatic events do not happen in isolation. Interpersonal trauma happens in the context of relationships, of families, as well as communities. Traumatic events on a larger scale, such as violent political unrest, and even the COVID-19 pandemic, affect even the largest group of people. Though each individual has his or her own unique response to a traumatic experience, we are constantly engaged with others in our lives whose responses range from resilience to long-term distress and challenges to normal functioning. When we come into contact with individuals who are struggling with intense responses to traumatic events, we are affected as well. Health professionals and those they serve benefit when they are aware of their own reactions to listening and working with those clients who have been traumatized and understand how these reactions and experiences may either facilitate or impede the therapeutic process and recovery of their clients. The next point we have there is lack of compassion satisfaction, as well as compassion fatigue. To explain burnout and vicarious trauma stress, I would like to touch on compassion satisfaction in order then for you to understand what compassion fatigue is. And then we'll go into it by exploring burnout as well as vicarious trauma stress. So with compassion satisfaction, the enjoyment and gratification that health professionals feel when they are able to perform their work well is referred to as compassion satisfaction. Helpers who experience compassion satisfaction typically feel that they are able to handle new protocols and technologies as they emerge. They also feel successful and happy with their work, and they want to continue to engage in their work. They feel satisfied and invigorated by their job and from the act of helping itself. They feel some helpers may experience enormous pleasure or contentment when the traumatized survivor or community they have worked with heals or is able to function better. Now we're going to look at compassion fatigue. Compassion fatigue has two components: burnout and vicarious traumatic stress. Burnout consists of negative feelings such as frustration, anger, exhaustion, as well as depression. Vicarious trauma stress may result when the health professional are negatively affected through vicarious or indirect exposure to trauma material through their work. In regards to burnout, many health professionals enter their profession because they want to help others in need. We tend to have strong empathic skills and are compassionate people. The very capacity of empathy and compassion amongst these professionals, however, in combination with the intensity of their work, their own personal vulnerabilities may be asked to intervene, can leave us at risk for compassion fatigue. Health professionals who are burnt out may not have the energy to provide the care that their clients need, or they may feel so overwhelmed that it compromises their ability to accurately assess their client's situation or needs, or to implement the most appropriate treatment plan. All of these scenarios can negatively affect the therapy relationship with the client and may in turn affect the client's ability to trust and form an effective therapeutic working relationship with other professionals as well. In regards to vicarious trauma stress, compassion fatigue usually develops over time as a cumulative result of helping many clients in challenging circumstances. It can, however, develop quickly when a professional responds to a case that is especially traumatic or challenging, in which the symptoms of vicarious traumatic stress may develop more quickly. The health professional may become traumatized as a result of becoming strongly focused and concerned with the suffering of the client while he or she is in a state of strong anxiety. When we look at the point of empathy, the recovery from trauma is promoted when the survivor experiences the therapy environment as a safe and secure place to integrate and work through the trauma and its effects. One of the key tasks, or rather challenges, of the therapist in this endeavor is to sustain empathy for the client throughout the process. The clinician's capacity to maintain their empathic stance and staying in tune with the client can become strained as the client shares more and more painful details of their traumatic experiences. Factors that stimulate the empathic strain vary from therapist to therapist. While empathic strain can come from a variety of sources, one of the prominent sources is counter-transference reactions. I would like us to focus more on counter-transference reactions to also then get a better understanding of the impact that counter-transference has towards vicarious resilience. The first counter-transference is avoidance counterphobic and detachment reactions. These reactions involve the professionals seeking to do one or more of the following: minimize the trauma, shifting the focus away from the trauma, denial of the existence of some of the symptoms of the client, or distancing themselves from the trauma or even the client. Therapists who have not experienced significant trauma in their own lives tend to be more vulnerable to developing empathic withdrawal in working with trauma survivors. These therapists tend to view the world as a just and a fair place. They may not have the extensive training about trauma or the treatment of trauma survivors. These therapists, therefore, may not be adequately prepared to be exposed to the powerful experiences of death, threats, and significant loss, or even horror, physical and psychological pain, and other severe traumas of their clients. The therapist may develop a host of painful emotions as a result of listening to trauma stories and witnessing the distress of clients in session. Receiving appropriate and extensive training about trauma and post-trauma stress reactions is generally very helpful as part of a plan to prevent or combat empathic withdrawal. The second type of trauma is over-identification reactions. Therapists who experience over-identification reactions may try to do things too quickly in their work with their client or engage in excessive advocacy on behalf of their client. They also have tendencies to rescue the client. They become enmeshed with the client, develop blurring roles in therapy and the relationship, and they develop an unhealthy or pathological bond with the client. They focus excessively on the client's traumatic experiences. This type of counter-transference reactions include different types of empathic disequilibrium or empathic enmeshment, or a combination of both. Therapists who experience empathic de-equilibrium often develop increased physiological and psychological arousal as a result of their counter-transference reactions. So for example, clinicians may develop distressing somatic symptoms, for example, stomach pains, headaches, pressure in their chest, as well as motor tension, or they become overwhelmed with characteristic types of emotional distress. So for example, an uncertainty about how to proceed with the treatment, feelings of vulnerability or insecurity about their own capabilities and abilities. This also can include self-doubt as well as strong anxiety. Health professionals who find that they're experiencing empathic disequilibrium will usually benefit considerably from adequate rest, time to recuperate and rejuvenate themselves, proper supervision as well as support, and reducing their exposure to trauma and minimizing work with highly traumatized clients. In this slide, we're going to be addressing counter-transference reactions. So to promote healing and growth from one's counter-transference reactions when working with trauma survivors, it is important to promote recognition. Recognition can be promoted by recognizing and also accepting that trauma changes things profoundly and that things will not be the same. The second way is when you are feeling distressed or badly affected by the impact of your work, take the time needed to assess the situation. Do things to soothe yourself and let yourself heal. Taking this time and being kind and gentle with yourself makes it more likely that you may be able to become rejuvenated and emotionally gain health again, to the extent that you'll be able to continue to work, including in the trauma field. Arrange for consultations or therapy to address areas triggered by the stories of survivors you work with that you have not been adequately explored in the past or that require additional attention. We also need to recognize that our emotional reactions to our work with trauma survivors may be interacting with old experiences that have not yet fully healed or even been resolved. By integrating your insight about these interactions, you may be able to grow professionally and personally turn your vulnerabilities into a source of strength as well as wisdom. Set up a supportive network of others to create a self-holding environment in which you can talk about the processes as well as trauma work. This network can consist of your professional colleagues who do similar trauma work, a consultation group, ongoing supervision, and/or one's own personal therapy. Establishing such a network can make an enormous difference in reducing the clinician's sense of isolation in doing this work. Engage in relaxation and creative activities, as well as hobbies to provide avenues for self-expression and regenerate energy on a regular basis. It is not a luxury or self-indulgent to have fun and unwind. It is essential in order to stay healthy if you wish to continue to professionally engage in trauma work. So sometimes you also need to ask reflective questions. Questions such as, do you check in with yourself regularly to assess how you are functioning at work and in other realms of your life? Are there particular populations or issues or settings and roles that you may find difficult for you to work with or in? Why or why not? Is there anything that you have found to be helpful in preventing you from burning out at your work? And do you have a burnout prevention plan in place? And if so, what is it? What would be the first step? And if not, what would be the first step to develop one for yourself? This slide pretty much demonstrates the vicarious resilience and vicarious trauma so that you are able to distinguish the difference and also perhaps maybe see it as an antidote for one another. So with vicarious resilience, we can see that changes in goals or priorities. We can see that it has an increased hopefulness and client-based inspiration. We can also see that it has a change or has an impact on spiritual beliefs and practices. It also increases in self-care practices, increased resilience and perspective of taking on one's own challenges. We can also see that it increases racial and cultural as well as structural consciousness and awareness of relative privilege, marginalization, as well as oppression. On the other side, we can also see that vicarious trauma has its own symptoms, and those are pretty much all the symptoms that are displayed there, such as sleep disruption, nightmares, fearfulness, irritability, fatigue, flashbacks, intrusive thoughts, disassociation, hyperarousal, and negative affect and numbing. Now we're going to look at the importance of developing vicarious resilience as health professionals. It might be asked why health professionals do work with trauma clients should gain knowledge and understanding of vicarious trauma, resilience, as well as self-care. Well, at a basic level, it is because we matter and the quality of our lives also matters. Health professionals are also orientated towards prioritizing the well-being of their clients over themselves. The development of vicarious resilience is highly useful in combating the exhausting processes that many health professionals experience that may otherwise lead them to feel victimized by their traumatized clients. The health and well-being of health professions is strengthened when they attend to both their vicarious trauma and vicarious resilience reactions. The motivation and determination of health professionals to continue to work with trauma clients may be strengthened if they become aware of the processes of vicarious resilience. Promoting opportunities and context for health professionals to explore vicarious resilience may serve to enhance their experience of it and how to find new meaning related to their work. Inclusion of the concept of vicarious resilience in therapy, training, and supervision sessions can help support health professions to take care of themselves better. Health professionals may generalize what they have learned about resilience from the survivors they work with and apply it in their areas of their own lives. such as crises they may confront outside of work. Another point is informing clients about the concept of vicarious resilience may be therapeutic in allaying any worries clients may have about infecting their therapists with their toxic trauma stories, and thereby may support the process of therapy. Another point would be that health professionals may find their view of their clinical work and career development is enhanced and expand through their deepened awareness of their presence of vicarious resilience, in their work. So now we are going to be looking at the different dimensions of vicarious resilience. So these different dimensions of vicarious resilience were tested to develop a certain scale. The scale is called Vicarious Resilience Scale, and that is something that we'll discuss a little bit later. So one of the dimensions that was brought forward was the changes in life goals and perspectives. So post-traumatic growth refers to a phenomenon of stress which leads to a positive transformation of the self. A traumatic or harmful event may disrupt the victim's assumptions and narratives about his or her life and change the victim's perception of day-to-day events. Trauma survivors tend to have positive changes in their philosophy of life. They reassess what really matters to them, feel more compassion for others, and place a higher value on their relationships with their family and friends. So through research, it has been evident that helpful professionals who are empathic towards trauma survivors experience vicarious post-traumatic growth, which causes changes in their philosophies of life, as well as their goals and their perspectives. The second dimension that we have there is client-inspired hope. So can clients inspire hope in their therapists? And if so, how? Clients influence their therapists in positive ways, and the therapists can experience personal growth as a result of their work. Therapists may emerge when they are willing to be influenced by the hopefulness of their patients in the course of the therapeutic process. The next point we have there is increased recognition of the client's spirituality as a therapeutic resource. So confronting and finding a meaning for suffering is a major task of religion and spirituality. People often seek answers to the challenges of life via their faith and/or their spirituality. Mindfulness practices can enhance skills which are crucial for a therapist, such as attentiveness and empathy, and have a positive influence on the therapeutic relationship. Religious practices and beliefs may also improve mental health. They may also strengthen psychological well-being and have a beneficial effect on distress and anxiety disorders. If we look at the increase to self-awareness and self-care practices, self-care plays a vital role in the well-being of therapists. This points to the need to balance a healthy mind and body to prevent irritability, insufficient or unsatisfactory sleep, doubts about one's even own therapeutic effectiveness. A therapist's ability to recognize the benefits and risk of trauma therapy may depend on an emotional self-awareness, which allows him or her to deal with the therapeutic process in a healthy manner. This slide will discuss dimensions. Dimensions, it's a continuation of the previous slide. And we are going to be looking at the increased consciousness about power relative to social isolation. So in this instance, health professionals have an awareness of cultural values and the socio-political importance of privilege or discrimination, as well as oppression. They also have an understanding of the background and the influence it has towards vicarious resilience. The next dimension is increased capacity for resourcefulness. Health professionals have greater sense of personal and professional resourcefulness and self-efficacy as a result of their work with trauma survivors. A central feature of this change would be that they would attain a stronger sense of their own resilience in the light of their clients' capacity to recover from terrible experiences. Furthermore, the therapist's positive emotions can improve the therapeutic process by strengthening his or her resources. A positive attitude leads to compassion and closeness to the patient and may spill over to the therapist's personal life. Moving on to the next point, where it's an increased capacity for attentiveness to the client's narrative of trauma. In psychology, while psychology defines therapeutic attentiveness as a suitable contact with three aspects of the perception of reality, being that it's embedded experience, it's an embodied experience, the environment is external to the body, as well as interpersonal relationships. They believe that a full engagement with each of these aspects is crucial for the success of the therapeutic process. So as previously mentioned, those dimensions that we previously discussed were used and were tested to then develop the Vicarious Resilience scale. So from the dimensions that we had introduced, the Vicarious Resilience scale was developed and tested based on the dimensions that we previously discussed. The VRS is a valuable resource for health professionals as well as trauma survivors in assessing the positive impact of their work and tracking it over time. It is also used in combination with other scales to assess vicarious trauma as well as self-care. Health professionals will be able to assess the impact of their work more holistically, allowing them to build on their vicarious resilience while developing targeted plans to care for themselves. So as health professionals, we need to be aware on how to enhance our professional quality of life. So in addition to using self-assessment tools, a well-developed strategy to address and hopefully prevent compassion fatigue, as well as vicarious trauma, and to promote compassion satisfaction and vicarious resilience will include multiple modalities. And one of the modalities is continued education. Professionals who work with trauma clients should strive to continually update their knowledge and skill set for both ethical and practical reasons, especially given that the field of traumatic stress is constantly evolving. Furthermore, the knowledge base about emerging, promising, and best practices with diverse traumatized populations is ever growing. Numerous scientific meetings and conferences abound around the world each year, contribute to the dissemination of research and clinical knowledge in the field of trauma stress. Another modality could be personal therapy. Engaging in one's own personal therapy needs to be promoted. And at some schools, it is required for graduate students studying to be health or mental health professionals. Personal counseling is encouraged in order for health professionals to explore and enhance their awareness and address any issues that may negatively or positively affect their ability to work with trauma clients. The next modality would be supervision. Health professionals are strongly encouraged to continue receiving ongoing supervision throughout their career, in addition to engaging in their own person therapy. Supervision should ideally be provided by a more seasoned supervisor who with expertise relevant to the populations with whom the health professional is working with. Supervision should also encompass the following. It should encompass therapy, whereby theoretic orientation that provides a clear understanding and conceptualization of how trauma affects psychological functioning, therapeutic treatment goals, as well as techniques. Supervision should also encompass education, information and education about management of symptoms, as well as the most common dissociative and post-traumatic adaptations should also be included. Relationships should also be included in supervision, and also how to maintain a professional therapeutic relationship with our clients. In regards to safety issues need to be addressed, and a safe and respectful space provided to attend to counter-transference issues. And also, vicarious trauma should be something that is also included in supervision, whereby education about vicarious trauma, as well as guidance regarding developing a plan to attain vicarious trauma, and education and mentoring to enhance one's vicarious resilience. Peer support and self-care techniques is also very important. It can be valuable to also participate in peer group supervision. This can provide an effective avenue of support for preventing and attending to negative impacts of trauma work, as well as fostering vicarious resilience. The practice of mindfulness has emerged as a key component of various approaches to working with survivors of complex trauma. Meditation and other mindfulness practices have been proven effective in supporting the well-being of trauma professionals and other care providers, including helping to prevent them from experiencing compassion fatigue. Health professionals are also encouraged to consider adding mindfulness practices to their repertoire of enhancing their professional quality of life. Another modality, and the last one, is supportive organizational culture that builds resilience. Primary prevention strategies that build resilience begin with the alignment of organizational values with an individual's goals and values. These values solidify a culture of strong communication, ethical management practices, and visible leadership support. Incorporating professional well-being in the organization's mission and vision, and adopting the value of personal, family, and work-life balance is foundational in guiding behaviors that promote resilience in the workplace. Now we will be looking at how to enhance our individual quality of life in our personal spaces, at home, or when we're with our families. The first one is communication. We need to be able to communicate with our co-workers, our supervisors, and employees about job stress while maintaining social distancing. We also need to identify things that cause stress, and we should be able to work together to identify solutions. Talking openly with our employers as well as employees about the pandemic is also effective. Ask about how to access mental health resources within your workplace as well. Secondly, we need to also identify those things which you do not have control over, and do the best you can with the resources available to you. You also need to increase your sense of control by developing a consistent daily routine when possible, ideally one that is similar to your schedule before the pandemic. Within that, we also need to keep to a regular sleep schedule. We need to take breaks from work to stretch or exercise or check in with your supportive colleagues, co-workers, family, and friends. We also need to be able to spend time outdoors, either being physically active or relaxing. If you work from home, you need to also set a regular time to end your work for the day, if possible. We also need to practice mindfulness. More importantly, we also need to do things we enjoy doing after hours. In this regard, we also need to know the facts about our COVID-19. We need to be informed about how to protect yourself as well as others. Understanding the risk and sharing accurate information with people you care about can reduce stress and help you make a connection with others. If you are being treated for a mental health condition as a health professional, continue with your treatment and be aware of any new or worsening symptoms. We also need to remind ourselves that each of us play a crucial role in fighting the pandemic whilst maintaining our well-being. We need to remind ourselves that everyone is in an unusual situation with limited resources. We also need to be able to connect with others. We need to talk to people you trust about your concerns, how you're feeling, or how the COVID-19 pandemic is affecting you. So to conclude this presentation, Vicarious Resilience often instills in trauma health professionals the hope. It installs the understanding and belief that it is possible to recover from serious trauma as well as other challenges. Having such a positive stance can promote the well-being of trauma professionals while at the same time sustain them in their work. Many learn from their clients to become more resourceful, active, and resolute in conquering their struggles and problems, often in comparison to what their clients have faced and overcome. Health professionals' own struggles can now seem to be more manageable. Thank you.
Thank you so much, Nizazi. That was very, very insightful. And I think for me particularly, realizing that working with our clients can really have a profound, like you said, profound personal growth and impact on us. And it can change us in a unique way. So thank you so much. I would like to ask any of our participants, any questions from your side. I don't currently see any questions in the Q&A section, but please feel free. We're going to open up for questions now to post any questions that you may have or raise your hand and we can just hand over to you to ask your questions personally to Nizazi. No questions so far. I would also like to take the opportunity to just remind you to please post your name, full name and surname and registration number in the Q&A section. I see we have quite a few participants, but there's only been two posts so far. So please remember, if you want CPD accreditation, remember to post. We'll download the list afterwards. No questions so far. I'm going to give it another minute or two There we go. Putti, do you have a question for us, or are you posting your registration details? I just see your name. It's silence. Zazie, anything else to add from your side?
Well, I'd like to say that Vicarious Resilience can definitely play a huge impact in our profession as health professionals. Building that resilience and being able to learn from our clients is very important. And I think that not all horrible experiences need to be horrible. We can always gain something positive from it. We can always realize our own strengths as well. With dealing with trauma survivors or, long-term issues surrounding trauma. So I think it's a very, very important tool that can take our careers far.
No, definitely. And it's a different take on working. We all know why, deep down, why we chose this profession. But this is just a confirmation, once again, of what an impact we really have on each other's lives. So thank you for sharing.
You are most welcome.
I don't see any questions. So I think then we're going, oh, I do. Mpumi has a question. Sorry about that, Mpumi. Your hand is up.
Yeah, hi Veronique, hi Zazie.
Hi there.
Hi Mpumi.
Yes. It's not a question per se on my side, but just to say thank you so much, Zazie. That was very insightful on my end. And because we go on with our daily lives without realizing the impact of, the stresses and the things that happen on our daily engagement and the things that we see on daily basis. So your presentation was very insightful, just to give us, that glimpse in terms of understanding exactly what is, trauma, and more basically the counter-transferent part. I think that for me was very insightful. Thank you so much for that.
Thank you, Mpumi. Anyone else? Questions from anyone else? Doesn't seem like we have any other questions. Faith said, thank you so much, Zazie. Very insightful presentation indeed. So thank you, Zazie. We definitely agree. It's Putti. Not Faith, Putti. Correction. Okay. I think that then brings us to the end of our session. Zazie, thank you for a wonderful presentation. It was really very insightful. And all of our participants, thank you for your time. Thank you for joining us. We will be hosting more of these sessions. We will send out communication with enough time for you to register and book it out in your calendars. So please do join us for our future sessions. And once again, thank you so much for joining us. Have a lovely afternoon and have a lovely weekend from the PHS team. Bye.